Non-small cell lung cancer, NSCLC. Non-small cell lung cancer, NSCLC, is the most common type of lung cancer, making up approximately 85% of all lung cancer cases. Unlike small cell lung cancer, SCLC, which is highly aggressive and fast-spreading, NSCLC generally grows and spreads more slowly. This slower progression means it is often diagnosed at an earlier stage, giving patients a better chance of effective treatment. NSCLC is not a single disease, but rather a group of cancers classified together due to their similar behavior and treatment approaches. The primary subtypes of NSCLC are adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Adenocarcinoma. Adenocarcinoma is the most common subtype of non-small cell lung cancer, NSCLC, and accounts for about 40% of all lung cancer cases. It is particularly notable because, unlike many other types of lung cancer, it frequently affects non-smokers. However, smokers are not immune to this form of cancer, as it can develop in anyone. Adenocarcinoma typically begins in the cells that line the alveoli, tiny air sacs in the lungs, and produce mucus or other substances. These cells are located in the outer peripheral regions of the lungs, which is why adenocarcinoma often forms in these areas. This type of lung cancer is more commonly diagnosed in women and younger people compared to other lung cancers. One reason it is often detected early is that it tends to cause noticeable symptoms, such as a persistent cough, chest pain, shortness of breath, and sometimes unintentional weight loss or fatigue. In some cases, patients may cough up blood, which prompts them to seek medical attention. Early-stage adenocarcinoma is more likely to be confined to a specific area, making surgical removal a viable treatment option. Squamous cell carcinoma, SCC, is a subtype of non-small cell lung cancer, NSCLC, and accounts for approximately 25 to 30% of all lung cancer cases. This type of cancer is strongly associated with long-term smoking, as the inhalation of tobacco smoke directly irritates and damages the cells lining the airways. This damage can lead to genetic mutations that trigger the uncontrolled growth of squamous cells, which are flat, thin cells that form the inner lining of the respiratory tract. SCC usually develops in the central part of the lungs, particularly in the larger airways such as the bronchi. This central location often results in early symptoms, making it more likely to be detected at an earlier stage than some other types of lung cancer. Common symptoms include persistent coughing, chest pain, and coughing up blood. Hemoptysis. As the tumor grows, it can obstruct the airways, leading to breathing difficulties, wheezing, or recurrent lung infections like pneumonia. Advanced cases may also cause symptoms such as unintentional weight loss, fatigue, or pain. In other parts of the body, if the cancer has spread, metastasized. Under a microscope, SCC tumors show unique characteristics, such as the presence of keratin, a protein found in hair and nails, and specific patterns of cell growth, which help doctors confirm the diagnosis. Large cell carcinoma. Large cell carcinoma, LCC, is a subtype of non-small cell lung cancer, NSCLC, making up about 10 to 15% of all lung cancer cases. This form of cancer is less common but notably aggressive, often growing and spreading more quickly than other NSCLC subtypes, like adenocarcinoma or squamous cell carcinoma. The name large cell carcinoma comes from the appearance of the cancer cells under a microscope. They are large, abnormal, and lack the specific features seen in other lung cancer subtypes. LCC can develop in any part of the lung, but it is most often found in the outer regions, peripheral areas. Its location and rapid progression make it particularly challenging to detect early. Symptoms often appear later in the disease and can include persistent coughing, shortness of breath, chest pain, unexplained weight loss, and fatigue. In some cases, coughing up blood, hemoptysis, may occur, especially if the tumor invades nearby blood vessels. One of the defining features of LCC is its aggressive nature. It tends to grow quickly and has a high likelihood of spreading, metastasizing to other parts of the body, such as the lymph nodes, brain, liver, or bones. This rapid spread can make treatment more complex and the prognosis less favorable compared to other NSCLC subtypes. Small cell lung cancer, SCLC. Small cell lung cancer is a less common but highly aggressive type of lung cancer, making up about 10 to 15% of cases. It is strongly linked to heavy smoking and often starts in the central parts of the lungs near the bronchi. SCLC spreads rapidly to other areas such as the liver, brain, and bones, and is typically diagnosed at an advanced stage. It is classified into limited stage, where the cancer is confined to one lung, and extensive stage, where it has spread more widely. Because of its aggressive nature, surgery is rarely an option. Treatment usually involves chemotherapy and radiation therapy, which can initially be effective. However, SCLC often returns, making it challenging to manage in the long term. Lung carcinoid tumors. Lung carcinoid tumors are rare, accounting for less than 5% of all lung cancers. These tumors develop in neuroendocrine cells, which produce hormones. They tend to grow slowly and are less aggressive than other types of lung cancer. There are two main types: typical carcinoid tumors, which are less aggressive and rarely spread, and atypical carcinoid tumors, which grow more quickly and have a higher likelihood of spreading. These tumors are often found in the central airways and may cause symptoms such as coughing, wheezing, or recurrent lung infections, though many cases are asymptomatic. Surgery is the primary treatment, as chemotherapy and radiation are less effective for this type of cancer. Pleomorphic tumors. Pleomorphic tumors are a rare and complex form of lung cancer, falling under the category of non-small cell lung cancer, NSCLC. These tumors are distinguished by their unique cellular composition, as they are made up of a mix of different cell types. Specifically, pleomorphic tumors may contain a combination of epithelial cells, which line the airways, and sarcomatoid cells, which resemble connective tissue cells. This variability in cell structure gives pleomorphic tumors their name, as pleomorphic refers to the ability of cells to take on multiple shapes and forms. The rarity and mixed cell makeup of pleomorphic tumors make them particularly challenging for doctors to diagnose and treat. These tumors can occur anywhere in the lung, and their symptoms often overlap with other types of lung cancer. Common symptoms include a persistent cough, chest pain, difficulty breathing, unexplained weight loss, and fatigue. As the tumor grows, it may invade nearby tissues or metastasize, spread, to distant parts of the body, such as the bones, liver, or brain. Salivary gland-type tumors. Salivary gland-type tumors are a rare subset of lung cancers that originate in the minor salivary glands located in the airways of the lungs, particularly in the trachea and bronchi. These tumors are similar in nature to salivary gland cancers found in the head and neck region, but their occurrence in the lungs is less common. They account for only a small percentage of lung cancers, making them a unique and distinct group with their own characteristics and treatment challenges. These tumors develop in the glandular cells that produce mucus and other secretions, which help keep the airways moist. Symptoms of salivary gland-type tumors often arise when the tumor begins to block or compress the airways. Common signs include persistent chest pain, coughing, difficulty breathing, and wheezing. In some cases, the tumor may also cause coughing up blood, hemoptysis, or recurring respiratory infections due to airway obstruction. Because these symptoms can mimic other respiratory conditions, such as asthma or bronchitis, diagnosis may be delayed until imaging or a biopsy reveals the tumor's presence. The growth of salivary gland-type tumors tends to be slow compared to other lung cancers. If left untreated, these tumors can invade surrounding tissues or metastasize to other parts of the body, such as the lymph nodes, liver, or brain.
Subscribe for more interesting stuff. Tell us your experience in the comments.